Hello, everyone. Good evening. I'm Sayukta from Beautiful Spotless Skin Team, and I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown color patches on their face. They look like freckle, like spots forming large, flat patches. This is nothing but melasma. Melasma is a common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population present skin color heterogeneity on the face, irrespective of their age and gender. This heterogeneity mainly results from hyperpigmented spot and melasma. Indian skin tone is more prone to pigmentary disorders. It occurs mainly in women, 90%, and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65-year-old women present a facial melasma. Melasma and hyperpigmentation, generally ignored as sign of aging and often misunderstood skin conditions. Melasma sufferers have been misinformed about aspects of this very common hyperpigmentation issue. This can lead to frustrating setback in treatment. So, to avoid all these and to keep you informed, today we are here to know more about management of melasma from experts. So, let's connect today with our skin experts. We have with us Dr. Rajdeep Mysore and Dr. Kavya. Both of them are from Bangalore. So, talking about Dr. Rajdeep Mysore, he is the chief dermatologist and dermatosurgeon. He is among the best dermatologists in Bangalore who has about 14 years of rich experience. His expertise as a best skin specialist offers best treatment for any kind of skin problems. Dr. Rajiv has been a speaker and panelist at several medical educational programs and conferences and is also starting a training institute for young dermatologists. Dr. Rajiv continues to look for leadership roles to transform society and address social issues. And at the same time, talking about Dr. Kavya, she has 3 years of experience in this field. Dr. Kavya is a member of Indian Association of Dermatologists, Venereologists and Leprologists and Bangalore Dermatological Society, BDS, and is proficient in the treatment of acne, psoriasis, vitiligo, fungal infections, alopecia, etc., etc. So, with their expertise today, they will enlighten us more on melasma and its management. A very warm welcome to both of you, Dr. Rajiv and Dr. Kavya. It's such a pleasure to have you with us.
Thank you.
So I'll start with you, Dr. Rajiv. You have so much of experience in this field, and we all know that melasma, even if we are not that familiar as a layman, not that familiar with the term melasma, we still know that this is a chronic, skin condition and is very evident in our society, especially in women. So, Dr. Rajiv, first of all, we would like to know what is melasma?
So, melasma is a type of pigmentary disorder. Any difference in color of the skin is termed a pigmentary disorder. And melasma usually presents with hyperpigmentation, that's increased skin color. And it presents as patches usually on the cheeks, sometimes on the nose, sometimes on the forehead and chin. And occasionally it can present on the back and forearms as well. Not much is understood about what causes melasma, and it's usually more common in women and around pregnancy, which has led to the belief that it could be related to hormones. But it's also seen in a small percentage of men and also seen sometimes in postmenopausal women who have no hormones at that particular point of time. So it's not clearly understood, but it's known that hormones play a role in melasma.
Right. So, as you said, that it's not clear what causes melasma, but definitely hormone, is a player in it. But moving to you, Dr. Kavya, what do you think? Who is the main culprit? Because many a times we see and we say that, melasma is due to sun exposure. So, how far this statement is true, Dr. Kavya?
So, as Dr. Rajdeep clearly mentioned, the exact cause of melasma is not yet known, but the most commonly considered factors, melasma is obviously multifactorial, like so many other conditions, so many other skin conditions. So, out of which one is obviously hormonal influence, as clearly seen and understood with respect to its occurrence during pregnancy. It's also called the mask of pregnancy or chloasma. So, along with that, other important factors that are responsible for causing or aggravating melasma is definitely sun exposure. Any type of pigmentation can get aggravated due to UV exposure. Now, apart from that, again, hereditary is another important causative factor, or as we call it, as initiating factor for melasma. So sun exposure, yes, as rightly pointed out, it does play a very important role.
Right. And as I have already mentioned that, we as laymen are not very much familiar with the term melasma, but then we are very familiar with the term pigmentary issues or, sorry, pigmentary issues or hyperpigmentation. So are they different, melasma and hyperpigmentation, or are they the same thing?
No, so melasma is one of the ways of how hyperpigmentation manifests. There are other hyperpigmentary disorders also, like the freckles or lentigens. They are other forms of hyperpigmentation. But melasma is also one of the forms of hyperpigmentary disorders.
So, Dr. Rajiv, we can say that hyperpigmentation is an umbrella or a broader term, and melasma falls under it. You would like to add something to that, Dr. Rajiv?
Yes, so hyperpigmentation simply means more pigment. And the pigment in the skin is melanin, that's the major pigment. And usually all conditions with increased amount of melanin are termed as hyperpigmentation.
Right.
It's a
And right. And Dr. Rajni, what are the signs and symptoms of melasma? And does they appear overnight or they grow gradually?
So it's a gradual onset disorder, and
Mhm.
it occurs over a period of several months and might increase over a period of months to years. And it's known to present with dark spots in a patchy form on the cheeks, on the nose, forehead, chin, the usual manifestation. And very rarely it can occur on other parts of the body. And usually, most affected areas are sun exposed areas. So, definitely the role of sunlight is there as well. And we do see that, when a patient goes on a holiday and comes back, they're on treatment for melasma and it worsens because of sun exposure. So, sun protection is a very important part of melasma treatment.
Okay, now I would like to gather all the informations that we have, gone through so far. For example, you have said that, sun is one of the major culprits, or hormone is have some role to play in melasma, or women are more prone to have melasma. But the thing is that in our society, we know that many a times women are mostly indoors. Their, sun exposure or outdoor exposure is not that much. But still, even if they are mostly in their kitchens, we see a lot of women who are homemakers, who are working from their homes, who are suffering from melasma. Dr. Rajdeep, I'll come back to you. Why is it so?
We live in a tropical country and sunlight is present everywhere. Sunlight is present in our homes. It's very rare that you have rooms where there's no sunlight at all. And it's not the heat or it's not external sun exposure. It could be sunlight that's entering the homes. It could be spending time in front of the flame, in front of the blue light of the flame. So UV light and blue light are implicated more in the formation of melasma. So even spending a lot of time in front of the flame cooking, or IT professionals who spend a lot of time indoors, work from home, but spend a lot of time in front of their laptops, are exposed to blue light or UV light. So we usually prefer specialized sunscreens with a blue light filter for melasma.
So, whatever radiation is coming from whatever source is harmful for our skin. And Dr. Kavya, how can we prevent melasma? Is there a way to prevent melasma? Because generally in medical field, we say that prevention is better than cure. Any way to prevent melasma?
So melasma is not completely preventable, but yes, like Dr. Rajdeep clearly mentioned, continuous, constant use of sunscreen can definitely play a very good role, like in the long run, especially in at least delaying the onset of melasma. Definitely, I would say that.
Okay.
For most of
And
us,
again,
application, yeah.
yeah, please continue.
So for most of us, application of sunscreen has not been a very constant thing. With right now, currently, the current scenario with the advent of social media and exposure and various sunscreens that are present in market, that okay, like from early 20s onwards, people are in for application of sunscreens, but that has not been the case for the longest time. So because of which, with constant exposure to sunlight, without application of a sunscreen, that has been one of the major causes of occurrence of melasma. So definitely it can be delayed by application of sunscreen. Yes.
Hmm. Dr. Rajdeep, I'm sure you'll also agree with me. In India, people have all kinds of complaint about sunscreen or excuses for not using sunscreen. Some will say that I don't like the patchy, or the dull feel that I get, or I start sweating a lot when I use sunscreen. I don't like the white cast, or my sun exposure is hardly there. Why should I use sunscreen? So there are a number of things that people normally say about sunscreen and don't use it as a regular thing. So, Dr. Rajiv, what's your say on that? What would you like to tell to all those who are still not using sunscreen as a regular thing? Because in India, statistics says that 67% of people are still not using sunscreen as a daily skincare routine.
Yeah, absolutely. So we face the same problem when we try to convince our patients to use a sunscreen. Fortunately, Indian skin provides a certain SPF on its own. So we do have better sun protection naturally than, let's say, Caucasians who have very less melanin. But sunscreen use is important not only to prevent melasma, but other signs of skin aging as well. So sunscreens can prevent wrinkles, can prevent acne, can prevent certain infections like herpes, which gets triggered by sunlight. And most importantly, it gives you a uniform skin tone. So we try to find a common ground where the patient understands that it's important for their skin. And if they understand and if they're aligned that without a sunscreen, any pigmentary creams are not going to be as effective, and that melasma is going to recur again. So this is one of the ways we can convince people to use a sunscreen. And of course, we have very good quality sunscreens available now. We have micronized sunscreens which don't leave as much of a white cast. We have matte finish sunscreens which are not oily. And for those who have dry skin, we have cream-based sunscreens which offer moisturization. We have all sorts of antioxidant sunscreens. We have pollution control sunscreens. We have caffeine sunscreens, so which has coffee extracts, which is beneficial to the skin. So we have a lot of variety of sunscreens in the market today, and based on the skin type and the patient's affordability, that's also an important factor for patients in our country. So based on that, there are a variety of sunscreens, and we do find something that suits the patient.
Right. And, as an extension only to this question, Dr. Kavya, I would like to ask you, when we go out to buy a sunscreen for us, of course, there is one way we can go and consult the dermat for suggesting us the, sunscreen as per our skin type, as per our working condition. And definitely the economics part should also be kept in mind, as Dr. Rajdeep has just mentioned. But apart from that, when we go to buy a sunscreen for us, there are so many informations on the box or on the tube, right? Starting from SPF to whether boot star rating to whether it's broad spectrum or not, so on, so on. So, what are the basics to look for, Dr. Kavya? If, for example, if I'm a lady and I have sun exposure or whatever, other exposures to harmful radiations, what should I look for?
So one thing is, like you rightly mentioned, it's the SPF or the sun protection factor. So as Dr. Rajdeep mentioned, we live in a tropical area, right? So at least anywhere between SPF 30 to 50 is compulsory, is what I would like to say. Now, apart from that, especially if you're someone who is working in front of the laptop, like, software professional, always in front of, there's a lot of blue light coming out of it, right? So blue light protection, again, is something that I would highly recommend. And also the broad spectrum sunscreen, which basically covers almost all of the radiation. So that would also be one of the important, factors to be considered. But yeah, having said all of that, always consult your dermatologist because they will be, in the position to try and understand your skin type and accordingly suggest the right sunscreen for your particular skin type.
Right. And I have seen
Mm.
people saying when they, end up finding the right one, they say that this is the best thing that has happened to them in case of, skincare. And
Yeah,
it actually works as a wonder cream. And as Dr. Rajdeep very correctly said that, it actually works as an anti-aging product as well because it will limit
definitely.
your wrinkles, etc. So moving on to you, Dr. Rajdeep, again, just not sunscreen is just not about buying them. It's also about how we apply, reapplication, the amount we are, applying, when to apply, when not to apply. Please shed some light on that as
Yeah. So sunscreens are measured in fingertip units. Any topical creams are measured in fingertip units. And one fingertip unit is up to the first line on your index finger, from the tip of your index finger to the first line. So that's one fingertip unit. And usually for the face, you require about 2.5 fingertips. And for the arms, you require about 5 fingertips. And this is a rough estimate. Most of the good sunscreens mention the fingertip units required for each area of the body. The next thing is frequency of application. So most sunscreens last for about 3 to 4 hours. So if you're outdoors, you need to apply every 3 hours, or if you're indoors, every 4 to 5 hours should be sufficient. And there are certain long-acting, long-lasting sunscreens. Some sunscreens that claim to act for 24 hours or 12 hours. But still, if you're sweating, the sunscreen is going to go off in about 2 hours. And if you're swimming, the sunscreen is going to last for about 45 minutes, even if it's waterproof. It lasts for about 45 minutes to 1 hour. So there are various factors that need to be taken into consideration while we prescribe a sunscreen. And we try to discuss about the patient's lifestyle and what time they wake up, what activities they do, whether they do outdoor activities and or they spend most of their time indoors. So based on that, we suggest a sunscreen.
well. Right. So the bottom line is that sunscreen is very important. We need to go and consult with our dermat so that we get to, find out a good formulation for us. Dr. Kavya, as we are talking about sunscreens, as we are continuously saying that here people are yet not that used to with sunscreens, or it's not a regular religious thing for them. So anyways, we are trying to convince them with all the facts and figures. Now moving on, when we talk of melasma or when patients come to you, how do you diagnose melasma? Just by physical examination, investigation, clinical investigation, you can do so, or you need some test to diagnose melasma?
So, melasma is one of the commonest conditions that we come across. And having said that, yes, physical examination history is one of the most important things. So, when the patient comes to us, we will try and understand like how it started, in which area. Like Dr. Rajdeep mentioned, melasma is one condition that can occur either on the cheeks, the nose, the forehead, the chin, anywhere, right? So, there are different types of melasma also. So, we try and understand how it started, like the origin of pigmentation and how long did it take for the progression. And on top of that, and it's very typical and it's very classical of melasma, when it presents as like a blotchy pigmentation, that will obviously give a clue to us. Now apart from that, there's another tool that we use to diagnose, and that is the wood slamp examination that we do. So wood slamp is like a portable instrument sort of thing. Like there is this a UV light that we use. So when we try and look through the UV light, we will try and understand because melasma can be either epidermal or dermal. So just to simplify, epidermal is when it is in the topmost layer, when the pigment deposition occurs in the topmost layer of the skin, or dermis is when it's on the deeper layers. So when we look through the UV light, we will have an understand, that is the Woods lamp, we will have an understanding of whether it's epidermal or dermal, because that also plays an important role in our treatment aspect. Because if the pigment deposition is occurring in the topmost layer, then the treatment is comparatively easier. I wouldn't say fully, but dermal pigmentation is definitely more difficult to crack. So yes, a diagnosis of melasma is mostly clinical, but it can be aided with the use of a Woods lamp.
Now, initially, Dr. Rajdeep said that, it's a gradual thing and it grows gradually. It's not that one, fine morning you'll wake up and you'll see melasma all over your face. You will start with small freckles, spots, etc. So, is that a sign that you need to go and consult a doctor? Because in our society, we have this tendency of whatever happens on our skin, on our scalp, on our hair, we'll try some home remedies, or we'll ask a friend and family, or we'll go for over the counter products, we'll go to the chemist and ask for some, ointment or something. So, which is the right way? By passing all the home remedies and all this, are we delaying or prolonging our condition, or is it okay to try these things and then go to a doctor in case nothing works? What's the right way, Dr. Kavya?
So melasma is a very tough condition to crack. You know, what I mean is once you end up developing the condition, it takes a very long time, for the treatment to kick in and for you to see visible results. So definitely the earlier, the better. Prevention is obviously with the regular use of sunscreens, but the moment you start noticing some kind of pigmentation anywhere on the face, I would highly suggest you see your dermatologist at the earliest.
Right. And Dr.
Definitely.
Rajdeep, with all the social media influencers, because it's just not about the home remedies or the over the counter products or the chemist shop or the friend or family. Now it's the influencers as well who have quick remedies for almost everything, especially for, skin related issues. And people fall for them. And they'll end up buying the products that they are endorsing, and we'll keep on worsening our condition, and by the time we land up in front of a doctor, that's when we realize that if we could have come earlier, the length of the treatment would have been much shorter. What's your take on that, and what would you like to tell to our viewers?
Uh, First of all, I'd like to add another point that we use, another diagnostic tool that we use called dermatoscopy in melasma.
Mhm.
It gives us an idea about the depth of the pigment, as Dr. Kavya was mentioning, and our treatment varies based on the depth of the pigment. So while we talk about home remedies, usually people use some vitamin C based things. They may use lime juice, they may use amla juice, and they might use turmeric. As long as it's turmeric or aloe vera, it's harmless. It's all right. And there are certain preparations that we use for melasma that contains tetrahydrocurcumin, which is the active ingredient in turmeric. And so turmeric is fine. Turmeric is a good home remedy. You can try turmeric for a couple of weeks and see if it's lightening or not. And sunscreen, definitely sunscreens are very important. So the first thing you should do if you see a pigmentation is start using a sunscreen. And you can try niacinamide serums, you can try kojic acid, arbutin. You can give it a try probably for a couple of weeks or a month. But if you notice that the condition is worsening, visit a doctor. The most dangerous thing is the use of steroid creams given by chemists. So it's not the influencers, it's not the home remedies, it's the chemists that cause a lot of damage to the skin. And unfortunately, patients get quick relief with steroid based creams, and they get addicted to them. And by the time they come to our clinic, they're using these steroids for a year or 2 years. And it's very difficult to convince them to stop using these. So don't take a medicated product without consultation. But definitely you can try harmless home remedies. And please don't apply lime juice or toothpaste. These can damage, these can burn your skin. So these are harmful chemicals. So, whereas a simple thing like turmeric is perfectly fine.
Right. I'm sure that will be very helpful for our viewers. Now, Dr. Kavya, we would like to know about all the treatment options that's available for treating melasma.
Treatment options. So we start with the topical therapies, right? So there are various topical therapies that are available for treatment of melasma. So which includes the depigmenting creams. So the active ingredients again here will be the regular kojic acid or niacinamide, as Dr. Rajdeep was rightly mentioning, and also hydroquinone. That's another important ingredient or the important constituent that is most commonly used. Now, so this is the topical therapy that we are talking about, but also there are other options available like the oral supplements of for treatment of melasma. So that also includes. So there's this important component called the tranexamic acid. So that really helps with the treatment of melasma. Now, apart from this, there are also lasers that are available. So the Q switch lasers is what we commonly use. That is also available for the treatment of melasma. So it is the topical therapies, chemical peels, and the lasers that are commonly used for the treatment of melasma.
Okay.
On a broad classification, that is.
Right.
Yes.
Dr. Rajdeep, would you like to add something to that? Plus, there is a viewer who has a question related to the treatment part. John Vargas is with us. His question is, are there any side effects or risk associated with melasma treatments, Dr. Rajdeep?
Yes, as I mentioned earlier, there are creams which contain steroids and hydroquinone. These are definitely useful for treating melasma, but we should know where to use it and where not to use it. These are strong prescription grade medicines and not to be used by chemists for dispensing them. Unfortunately, these regulations in our country are not enforced. Chemists can sell, medicines to the patients directly. The only thing that is really enforced in chemist shops is probably narcotics, so which they're not allowed to sell directly. Whereas steroids are freely sold to the patients, and the bad thing about steroids is that they act very fast, and so the patient gets hooked to them. So when we prescribe a cream containing hydroquinone or steroids, we do use them. They're very useful in the treatment of melasma. We always give it with caution. We ask the patients to try it, use it for a half an hour and wash off, see if there's any irritation reaction, and use it for a short time. We give it for a very short duration, probably 1 month or 2 months, not more than that. And a very low dose of this steroid hydroquinone combination, it's also called as a triple combination. It has steroid, hydroquinone, and tretinoin. So this is a very common combination used for treatment of melasma. It's safe when it's used judiciously, trying to understand the skin type and with a dermatologist prescription. Whereas if you're using it on your own, you don't know if your skin is getting damaged. There's nobody to assess your skin every month. And in the early stages, we're able to assess and prevent that damage. Whereas if you're using it for a very long time, let's say 6 months or 1 year, you come to the doctor and there's hardly anything we can offer at that stage. So definitely there are side effects associated with melasma treatments. Even peels can have side effects. So peels also, we need to understand the skin type. We need to prepare a patient's skin before we start peels. So it's a complex process, and it doesn't have a simple option. And unfortunately, melasma tends to recur. So even if you have treated it initially, you need to be on long-term maintenance if you want to prevent the recurrence.
And I think that's what makes it even more important to go to the doctor and go to a good qualified dermatologist, because the all these procedures, treatments, it needs skills. What happens, because as you're talking about peeling, many saloons, parlors are also there that they are offering peelings, etc. Then quacks are definitely there. So that's why it becomes even more important to go to the right person, which is a qualified
Exactly.
dermatologist.
Exactly. Yeah.
Right. Uh, Dr. Kavya, initially we said that, even during pregnancy, we see a lot of women go through melasma. Many a times it fades away postpartum, many a times it doesn't. We know that in pregnancy, over-the-counter products are a big no-no. Many times, even sunscreens comes with the warning that if you are lactating or you're pregnant, please do not use this. What do you offer to ladies who are pregnant or are lactating?
So, during pregnancy, the melasma that occurs, it's called the mask of the pregnancy or cloasma. So, accordingly, we will have to see and assess the patient and try and understand if it is melasma. Accordingly, we have the triple combination that can be given even during pregnancy. So, that is what we will be suggesting for the patients. So, as Dr. Rajdeep mentioned, it is the triple combination of tretinoin and hydroquinone and a steroid. So, that is what is suggested even for pregnancy, even during pregnancy. But
Yeah.
again, chemical peels are also safer for use during pregnancy. So are lasers.
Okay.
Can I
Dr.
add?
Rajdeep? Yes, yes, please.
So in pregnancy, sunscreens which we use are usually mineral sunscreens. Mineral sunscreens do not penetrate the skin. They're not absorbed by the skin. They form a coating on top of the skin. So you might have seen
They are like
cricket
physical sunscreens.
physical sunscreen.
Exactly.
Physical sunscreens are preferred in pregnancy. I would not use tretinoin in pregnancy, and I would prefer using something with azelaic acid. Azelaic acid is a very safe molecule in pregnancy, and it does help to reduce the pigmentation. We can also use kojic acid, licorice extract, and other mild depigmentary agents, but prefer to use the most common molecule that I would like to use in pregnancy is azelaic acid.
Okay. So again, if you are pregnant ladies or you are lactating, please go and consult your dermat in case you have, melasma or any hyperpigmentary issue. Please consult your doctor. That's really important. Now, Dr. Kafya, many times we see that, and Dr. Rajdeep also have mentioned initially that family history do matters, right? Now, in case my parent or both of them or any of them had melasma, I definitely have more chances or risk of having melasma. In this case, what can I do as a prevention and when to start? I mean, during even teens, can I start using sunscreen as a preventary measures, or what should I do?
Yes. So the most important preventive measure for melasma is application of a sunscreen. So even as a teenager, you can start using a sunscreen. Yes, there are certain sunscreens specifically formulated for children also. Like Dr. Rajdeep was mentioning, the mineral sunscreens are, or the physical sunscreens are extremely safe for use in children also. So right from a young age, application of sunscreen goes a long way in prevention of melasma, occurrence of melasma, especially if there is a family history, then definitely it is the most important way to prevent the occurrence of melasma.
Fair enough. Dr. Rajdeep, many times, people with melasma will ask this question that will it ever get cured permanently or I'll ever get, completely rid of melasma? Oh, what's your say to that?
Yeah, fortunately, melasma goes away on its own, and till it goes away, it's a long battle. We need to, suppress it and keep it under control. Uh, Usually, melasma lasts for anywhere between 5 to 15 years. So very rare cases, 20 to 25 years. But then one fine day it goes off, and fortunately, that's the good news. That's the silver lining that we see.
So
And
have patience till that one fine day.
yes, and till then there are a lot of treatments. We try to balance the side effects of treatment. So for a few sessions we might do a peel. For a few sessions we might go with laser, and probably for a few months we might go with topical creams. So we always try to cycle the treatments to prevent the side effects.
Right. So please don't waste your time, viewers. In case you see any sign of melasma, please go and consult your doctor. Of course, you can do those home remedies that doctor has said that they are safe, but still you need to go and consult a doctor. That's always advisable. Deepak Saxena is here. Very interesting question. Is it possible? Is it possible for melasma to go away on its own without any treatment, Dr. Rajdeep?
Absolutely. Although it might take several years to go away, but it's a harmless condition. And if you're not really concerned with it and it's not bothering you, not affecting your self esteem, because it's something that's on the face and it's something that you
Right.
see each day. So, this is the thing that affects most of the patients. Of course, there are some people who don't really bother about cosmetic concerns, so it's not something that absolutely requires treatment, but if it does bother you, do seek treatment from a dermatologist.
Right. Dr. Kavya, we have a viewer, Rahul Vatswar. His question is should I avoid sun exposure if I have melasma, and how can I protect my skin from the sun?
Again, the answer runs back to the same usage of sunscreen, right? So, sun exposure
Apart
avoidance
from
might
sunscreen,
be
are there
definitely. So again, apart from sunscreen, if you can, use an umbrella maybe to prevent the direct, exposure to sunlight, that could really help. But apart from that, yes, especially on the face, it is mostly the usage of sunscreen. Yes, because complete avoidance of sun exposure might not be a practical option like on a day-to-day basis. So definitely avoidance of sun exposure completely is difficult. So sunscreen application is compulsory. And reapplication of sunscreen definitely goes a long way in, prevention of the spread, progress of the condition. Yes.
Yeah, so there are some, there is
right?
a concept called oral sunscreen as well. That's a new concept, and it's certain protective compounds like flavonoids and polypodium. So these are plant extracts that can be taken in a pill form, which can protect you from sunlight. Also, vitamin C, oral vitamin C is a good sunlight. It helps you to protect your skin from sunlight, and it's an antioxidant which helps in reduction of melasma. Although I don't think you should waste your time using vitamin C serums which are available in the market. Oral vitamin C is a good option.
Fair enough. So before we bind up the whole session, Dr. Kavya, uh, the do's and don'ts as a closing remark.
Yes. So one thing is the most important thing is the usage of sunscreen. Again, I know it all comes back to the same thing, right? And also avoidance of excessive sun exposure, usage of umbrellas, and as Dr. Rajdeep mentioned, maybe oral sunscreens, especially if if you find it difficult to reapplication again and again. So that is one thing. And also, oral vitamin C will also go in the long way. And please consult a dermatologist at the earliest because the larger area of involvement, the more time that it takes, also, it also has a very psychological impact on the patients when they have a lot of pigmentation on the face. So, the earliest they can seek out for advice, that would be the best. And don't is do not waste a lot of time trying out the home remedies for a very long time, maybe for some time, and then but try and seek the advice at the earliest. Yes,
Thank you.
that
And
would.
Dr. Rajdeep, any take home message for our viewers?
Melasma is not a dangerous condition, it's a cosmetic condition. So don't worry about it. Visit your dermatologist. Try to protect yourself from sunlight as much as possible, and increase the antioxidants in your diet. Most fruits contain antioxidants, so make sure you get plenty of vitamin C. Have citrus fruits, which will go a long way in helping you, protect you from melasma. And if you genetically have it, it's always a good idea to start using sunscreen from a young age. And if you want to decide what kind of creams suit your skin, skin specialist will be able to guide you with this information. So even seeking a consultation before you develop the problem is not a bad idea to understand what products suit your skin. And don't try too many over-the-counter products, especially a big no to medicated creams given by chemists. That's a big red light, and anything that makes your melasma disappear very fast probably has a steroid in it. Something that starts working within a week or two probably has a steroid in it, and be very cautious. Sometimes steroids are mixed into unlabeled creams given by beauticians as well. So be very cautious of any treatment that gives you instant results. It's going to have harm in the long term.
Very well said that there are no shortcuts. Thank you so very much, Dr. Rajdeep and Dr. Kavya. It was wonderful talking to you. Thank you for this very informative session. Thank you so very much, both of you.
Thank you.
Thank you.
And viewers, thank you for your excellent participation in today's session. Stay happy, stay healthy. In case you need to know anything or you want any consultation, please go and consult the right person. In this case of skin and scalp, dermatologists are the best. Please go to them. Thank you. Have a good day ahead. Goodbye.